Thank you for joining us this afternoon. We've got Dr. Jeanne Marrazzo, who's the director of the Division of Infectious Diseases here at UAB. She's going to be commenting on the status of the coronavirus, what we're seeing now, data, things of that nature. As the email indicated, she's not necessarily here to talk about hospital operations. We also know that a lot of people have questions about the new UAB symptom tracker that's out, and that's probably not the best place to ask Dr. Marrazzo those questions either. We're going to be sending some B-roll and some audio of Sue Feldman after this, so you will have that for your evening broadcast. Dr. Jeanne Marrazzo.
Thanks, Savannah, and hello, everybody. Hope you're enjoying this beautiful spring day despite the craziness of the pandemic. So just to sort of give you a sense of where we are generally since the last time we talked, which feels about a year ago, we globally have continued to experience dramatic increases in the number of cases of this infection, and we're closing in now on 750,000 cases with over 36,000 deaths. Unfortunately, the United States is now number one in the number of cases being reported, and has increased as well the number of deaths. And just last week, we were talking about reaching 1,000 deaths, and we're now about 4,000 deaths in the United States. The most worrisome areas, I would say, in the United States remain in New York City and New York State, New Jersey. Huge numbers of cases, lots of deaths, and very importantly for infrastructure, lots of patients requiring intensive care and assisted ventilatory support or intubation, i.e. getting put on a ventilator. And I'm sure you've seen some of the more alarming footage, scary stories about people being intubated at great rates in some of the emergency rooms, particularly in Queens, with them actually staying in the emergency room on ventilators. So I would say New York City right now is approaching a crisis point from what we can tell. It really has all the elements for this to have happened. In other words, people didn't really start social distancing there until the middle of March or so. It's incredibly dense. It's not that easy to get socially distant. If you've walked through Times Square on any weekend night or weeknight, you know how hard it is to even move. So New York is a great place for this to happen, unfortunately. Lots going on there. Other places that are worrisome are Detroit, which has increased their case number and their associated mortality remarkably in the last several days. Another city that I think could be at risk for a New York-like scenario. Miami, which is worrisome, particularly given the large number of older people that live in that area in southern Florida or South Florida. And then, of course, Louisiana, which is experiencing a very alarming number of not just cases, over 5,000 cases, but a lot of deaths there, well over 200 deaths in Louisiana. Unfortunately, Mardi Gras is identified as a potential original focus of transmission for this infection. There are probably a lot of people there who were feeling well. And that brings me to another point that we've learned a lot about in the last week, and that is the extent to which there is a lot of asymptomatic infection in people. Asymptomatic means you don't have symptoms. You don't have symptoms of a cough, you don't have a fever, you don't have muscle aches, you don't have shortness of breath. So you're generally walking around like you're feeling pretty healthy. Unfortunately, for about 5 days, when you have the infection and you have no symptoms, you are infectious. You can transmit it to people. And that's why the advice to just stay home if you're sick or stay away from people if you're sick is not enough. And that's why we continue to emphasize widespread social distancing. How many people have this infection and never get symptoms? We don't know. We won't know that probably for a while until we get some good tests to look at that. You can imagine we're preferentially testing people who have symptoms. Some places, the country of Iceland, for example, has done more widespread testing. Their early data indicate that maybe almost half of infections may have no symptoms, and yet they still may transmit the virus. So that's probably one of the reasons that this has taken off like wildfire in so many communities. It's also a really important reason that we need to encourage everybody, including healthy young people who might not feel bad or who just feel kind of a little sick, to not go out and spread the virus, particularly to people who might be more vulnerable. That will lead me a little bit into the question of who's more vulnerable. The CDC yesterday released a very nice report in their, it's called MMWR, their weekly report, and they looked at the first 120 plus thousand cases reported in the United States. Very clear that people who have illnesses along with or preceding the acquisition of COVID-19, like diabetes, cardiovascular heart disease, pulmonary disease, including asthma, COPD, or emphysema, all of those folks, unfortunately, are much more likely to do worse with this infection. We've known that for a while, and actually we keep coming back to that because it's such a concern for Alabama and the Deep South, given some of our health markers. But I think yesterday's report really drives it home and emphasizes that we need to take this especially seriously in the Deep South and in our Alabama communities. So where are we in Alabama? Unfortunately, we passed a not welcome milestone today, too. We are now over 1,000 cases with deaths in the mid-20s. So not great news. Cases are distributed throughout the state. It's hard to talk about exactly where they are relative to where they truly are because we are testing in certain areas more than others. Obviously, if you come to the UAB hospital emergency room with symptoms, we're going to test you. If you're sort of feeling sniffly and just staying at home, you're probably not going to get tested. So not having access to really widespread testing is and remains a challenge. That said, there's no question we're seeing more cases in the community. I think you'll probably have questions about what's going on at UAB Hospital, so I'll just give you a snapshot there. I think some of you have probably seen the graph that's been released pretty much daily over the last several days, showing that our census of patients with known COVID-19 is about 50. And that's stayed relatively stable the last few days. In addition to that, the number of people who are formally classified as people under investigation for COVID-19, and that means people who have symptoms that are suggestive of this infection, has varied anywhere between 30 and as many as 80. So on average, we have probably between 80 to 100 people that either have the virus or we are actively looking into whether they have the virus. Of those people who have the virus and are known, about a third are in intensive care and requiring ventilatory support or intubated. So one question I've been asked the last couple of days is, do I think that this is a good trend? Are we stable? Have our social distancing methods that we implemented now for well over a week in Birmingham actually made an impact? And it's really too early to say. I would love if that was the case because we have actually, I think, jumped on it faster in terms of where we are in the epidemic than many places, including New York City. So if we have been able to blunt the curve and flatten the curve, or blunt the slope, flatten the curve, whatever you want to say, that would be fantastic. I think it's a little too early to say, and we're going to have to continue to track this really carefully over the next several days. Other hospitals are experiencing very challenging situations, and I'm sure you're aware of those and you've seen those in the media. I think I'll stop there and would be happy to take any questions.
Great. Does somebody want to start off with a question for Dr. Marrazzo?
Hi, this is Dr. Marrazzo. This is Stephen at DC 3340 News. I had a question about a study I'd been looking for, and then I'd seen that you had retweeted out of the University of Washington regarding numbers statewide, nationally, but also in Alabama, a projection that showed a possible death toll of more than 7,000 cases by the end of August. What do you make of that kind of study, and what does that mean for what we're doing here in the state of Alabama to defend ourselves against this virus?
Yeah, great question. So that's a study from the Institute for Health Metrics and Evaluation, which is an excellent data modeling economic sort of group at the University of Washington. And they've put together a model, as I'm sure you know. You can go on their website, you can play with the data, you can actually look at different cities, different states, and countries overall. And what's different about their model, and the reason that it got so much press in the last several days, is that they used deaths to model the needs around intensive care beds and hospital facilities and ventilators. The other models, particularly the one that we talked about last week that came out of the London Imperial College group, they used case counts. And so they were saying you can expect this many case counts. The deaths are a pretty good indicator of the burden we're going to face. So I think it's a model that we have to pay very close attention to. The challenge in interpreting it is if you go on their website, and they just updated it a half hour ago, and they actually show somewhat worse predictions for us in terms of deaths, with a peak still anticipated to occur around April 19th. The challenge with that model is if you look at what the assumptions they are making that go into it include, they really don't reflect very much in the way of social distancing at all. It kind of right now assumes that we are not doing anything particularly aggressive to address this problem. It doesn't reflect the reality of the streets outside. For example, the fact that we have no visitors in the hospital. It does mention that schools have been closed, so it does account for that. But in the time since that's come out, there has been quite a bit of activity, as I know you know, both at the state level and certainly at the individual county level, and sometimes even in the city level in terms of curfews. So I think that that model is a worst case scenario that I hope and pray very much we are going to avoid, given the cooperation we've had from our local governments, from our excellent public health departments, and really from the community at large. So pay attention to it. Don't let it scare you so that you don't sleep at night, like I'm not sleeping at night. That's my job. But know that we are doing everything we can so that that's not what we see.
Does anybody, oh, 1 second. Anybody else have a question on the call?
Yeah,
I do.
Okay, sorry.
This is Morgan with Fox 6, and I was just hoping that the doctor might speak to an individual's personal responsibility when they're out in public and they're at these essential businesses like a grocery store, and they say social distancing isn't being practiced. What is your advice for that person? And then just talk about how each person has to really take control over their own health in this situation.
Yeah, it's a great question. You know, this is such a stressful time. The last thing I would want people to do is feel like they need to police their neighbors and the people they encounter in the grocery store, right? So if you see a congregation of people in the grocery store, you know, your healthy average 18-year-old group of four hanging out buying beer or whatever, you know, I would avoid them en masse. Really, I would just sort of try to keep my distance. You know, really, you could emphasize with people that it is the right thing to do for the community. But I think that we need to get the media message out that speaks to everybody. It's not just people my age or my mom's age who need to practice social distancing. Getting back to that issue of you can be infectious even when you feel good, and you can unwittingly and unintentionally transmit it to somebody you care about who could die. and do very poorly. So I think when you're out and about doing essential things, try to think very carefully about that distance and try to maintain that distance. One related question coming up that I'm sure someone's going to ask about is the question of whether everybody should be wearing masks when they're outside and going to the grocery store. I think it's a great question. I do not think it could hurt. If it makes you feel more protected and it doesn't make you feel invulnerable, i.e., oh, I can get closer because I'm wearing a mask, we do not want that. But I don't think it could hurt, and honestly, at this point, any little thing that people can do to protect themselves or to prevent them from shedding the virus through coughing or sneezing, if they are ill, they shouldn't be out, of course, at all if they're feeling those symptoms. But even if they have no symptoms and they want to wear a mask, maybe they have the infection and maybe it will help. We just don't know. Another thing I got asked today by another reporter was about whether it was safe to go outside, whether it was safe to walk your dog. And I mentioned that when I walk my dog, I have a leash that's about 6 feet long, and it's a great way. My dog's very friendly and wants to go up to people, so she can go up to their dogs, and with that 6 feet and that dog's leash, or whatever that is, I know that I'm really far away from people. And I think people do need reassurance that it's fine to go outside, and we need sunshine. We need to be seeing our neighbors, even if we're not having barbecues. And frankly, there's a lot more air circulation outside, so that it's not like being in a closed space where you're more likely to breathe recirculated air, like the cruise ships that we talked about, or an airplane, or a nursing home before an outbreak was identified there.
Great. I've unmuted. Is there anybody else on the line that would like to ask a question?
Tim Lockett from the Anniston Star. This is kind of maybe a double-barreled question, but I'm kind of wondering, do we have any numbers on how many people have shown up to be tested and have been sent away without a test? And also, do we have any idea how many people might be walking around with this virus who have not tested positive?
That's a great question. So the answer about access to testing, I would have given you a completely different answer even 5 days ago, let alone 10 days ago. So I'm sure you recall last week we were seeing the traffic jams outside of the Church of the Highlands. People were desperate to get tested. That has really calmed down a lot. So our testing sites now that have been deployed in collaboration with public health through the communities have been functioning really well. They're going smoothly, so people should be able to get tested if they want to get tested. I would still say if you don't have symptoms and you are not a close contact and you're not a healthcare worker trying to decide if you should go back to work, you probably don't need to be tested. At some point we may decide to do that, but right now it's not like testing is so available that everybody in the world should be tested. I would not say that. But I do think it's much better. Last week, I am sure there were people who were turned away who had very compelling stories. Either they were symptomatic and they couldn't jump ahead in the line because they were sort of testing everybody, or they were with somebody who was a contact, and so they were a contact of someone who was infected. Even the sites that were screening in the community changed their criteria later in that course of events to try to focus on people who were symptomatic. So really rapidly shifting landscape. I will say that right now, at UAB Hospital, we have, with our Department of Pathology, increased the testing dramatically. So we're now able to do, as of today, probably about 400 tests a day. So we've really been able to amp up the screening. We're getting requests to help other hospitals screen. So the technology is getting better. Again, we were at least 4 to 6 weeks behind, if not more, which is really, really hurt us for all the reasons we've discussed previously. But I'm confident now that if you need a test, you should be able to get tested. The Alabama Public Health site, which is great, adph.gov, I think, now has not only the cases listed by county, but they also have testing sites with little red flags on a separate page. So people can go in there and find out where they can get tested. They have a 1-800 line that you can call. So I'm very, very hopeful that people should be able to get tested. I can't answer your question about How many people who were truly infected were not able to know that. I'm sure there were some, but we probably won't know that until we have a look back and start looking at other ways that we can tell whether people are infected, like an antibody test in the blood, which is hopefully coming up soon.
Great. The line should be unmuted. Does anybody else have a question for Dr. Marrazzo?
Hi, Dr. Marrazzo. This is Henry Thornton with Yellowhammer News. President Trump has repeatedly brought up the drug hydroxychloroquine. I hope I'm pronouncing that correctly. And he's expressed a lot of optimism about it. I'd welcome any comments you have as a doctor about whether it might help any patients, whether it's being used in Alabama, just any information you can share about that drug and its potentially being used here, I'd welcome. Thank you so much.
Sure. You did pronounce it correctly. It's hydroxychloroquine, and it's a drug that's been around, I think, since 1920s. It's been around for a long time. It has anti-malaria activity. We most commonly use it now as a drug to treat people with autoimmune disorders, particularly lupus. It's a pretty safe drug, but when you aren't careful with it, you could get into cardiac or heart rhythm abnormalities. So mainly your heartbeat doesn't work right, which is not a good thing, obviously. Even on people who use it at relatively low doses, we like to follow their EKGs or their electrocardiograms. So it's not a benign drug. We have known for a long time that it has pretty good general activity against viruses, even influenza, but it's never really been shown to work in a clinical situation. So when the reason this came out was there was a small study in France last week, and this is, I think, what the federal leadership focused on, that did show that people who got this drug cleared the COVID-19 virus faster from their pulmonary system. And then there was another study that came out from the Chinese group that showed essentially no effect, really. So the study that I mentioned first got a lot of press. People glommed onto it and were like, oh my goodness, this is great, especially when you combine it with another antibiotic called azithromycin, which many of you are familiar with because it's what is in a Z-Pack. The problem with that combination is you can have additive or added toxicity to your heart rhythm. So it is not a combination I would want to use over the counter. All that said, two things. One is that there are now several clinical trials being mounted in the United States through several of our NIH networks that are looking at various combination and dosages of that drug, not only for the treatment of COVID-19, but also for the prevention of infection in healthcare workers who are exposed. And that's really exciting because if you could give people a low dose of that drug safely and it prevented them from getting infection, it would be fantastic, and it would be an extra layer of protection for our healthcare workers, right? I personally would not use it widely, especially for outpatient treatment of COVID-19. We do list it as an option for hospitalized patients. And if you look at the guidance that many hospitals have developed, and we have our own table and thoughtful set of guidance that we've developed in collaboration with our pulmonary colleagues, our rheumatology colleagues, and our surgery colleagues, we recommend it for hospitalized patients because we don't have anything else, right? And we do have an investigational trial of a drug called remdesivir, which is really promising. The only way you can get it right now is by being in this trial or through a compassionate use program, which is turning into an expanded use program, which is not active yet, except for pregnant women and young people under 18. So yes, we are recommending it with caution for hospitalized patients. I personally do not feel comfortable prescribing it to somebody for outpatient treatment. outside of the context of a clinical trial where they're going to get monitored and cared for, so we know there's not going to be a problem. So stay tuned for that. I think we'll have more information in the next, probably month, if not more, but people are really interested because, again, it's not fun, to say the least. It's horrible to be taking care of these patients in the intensive care unit and feel like you have nothing to do. So, of course, people want to do something.
The line is unmuted. Does anybody else have a question?
Dr. Marrazzo, this is Alan Collins with Fox 6 News. So just UAB is coming on board with their COVID-19 test symptoms tracker. How much of a help is that going to be it for the public and you guys, hopefully trying to get a handle on people who might be freaking out about if they have it or not?
Yeah, thanks for asking about that. This is an incredibly innovative, I think exciting project that could contribute to our understanding of what's going on in Alabama in a big way. I wasn't really involved in the project, so I can't speak to the details, and I would encourage you to take a look at some of the materials that are going to be rolled out with it. But the idea behind it is that if you've heard of the term crowdsourcing basically means that you go to people to try to tell you what's going on instead of setting up sort of more specialized centers for diagnostic tests or something like that. So basically, you're trying to get people to log into this very friendly, easy website, inviting website, to say, I don't feel very good today, or I feel fine, I have these symptoms, and these symptoms are concerning for COVID, which is part of what the website can actually tell you. So it's a great way to track some of the syndromes that we have been talking about that are consistent with and worrisome for COVID, especially in parts of the state where people might not be able to get to testing places easily, right? I mean, to get to some of these testing sites, you need a car. To find out where they are, you need to sometimes get online. So it's not easy to get the kind of data that we need that is at a really detailed local level. So that's what this effort is about. So it's going to roll out, I believe, today. It's live, but it will be ramped up and people will be encouraged to provide data. So very, very exciting if it does pan out, and I think it will. A number of other centers have used this. The Seattle group has used this. The Harvard group has used this. And we really need something like this in the Deep South, especially since, as I mentioned before, our epidemic is a little bit later on that curve than those northeastern and northwestern places that I mentioned.
Thank you. The line is unmuted. Does anybody else have a question for Dr. Marrazzo?
Good afternoon. This is Charlie with WBTM 13. Should we have a better understanding next week if the social distancing recommendations are helping?
Yeah, I hope so. The social distancing, so let me give you an example of where they appear to be working, and that's Seattle. So Seattle has now shown they implemented social distancing around, really serious social distancing around February 19th, so about 6 weeks ago. They have now, with the model that I mentioned before, shown that with that social distancing, they have actually probably come close to experiencing their peak. It'll probably be early April, and that peak will still stay below what that critical threshold is for ICU beds and hospital beds. So they actually seem to have flattened that curve that we've been talking about, and then you can anticipate that with ongoing social distancing, it will come down as more people become clear of their infection and we don't have as many people vulnerable to it. So that took, about 6 weeks before you started to see that change. I would say give us a couple of weeks before we know. If our number of patients requiring intensive care at UAB Hospital remains where it is for the next week, I would feel pretty positive. I mean, I may not go on record and saying, oh, wow, what a fantastic thing this worked, but it would be a very encouraging trend. So I would say we need to take it day by day, but we also need to look at trends over time and anticipate that people are going to stick with it. I'm worried that people are going to get fatigued with this, because it's not easy to do it for the first couple of weeks, but when you start to get into week 3, week 4, week 5, week 6, people are going to get, I think, even more antsy and going to want to sort of break away. And I do worry that without relatively good adherence to the recommendations, we might see some slips, but let's hope that doesn't happen. So yes, we should have some indication soon, but probably won't know the extent of the impact for a month at least.
The line is unmuted. Does anybody else have a question for Dr. Marrazzo? Any other questions from the call line? We'll go to Facebook if there's no other questions from media on the call.
I have a question, but I already asked one. Is that okay?
Yep, go for it.
Okay, thank you. This is Morgan with Fox 6. So some people, and this is on social media, so who knows how true it is, but they say that they're not doing the social distancing because they want to get infected, they're younger, and then they believe once they get it, they will not have any potential to get it again, like they'll be immune to it. Is there any research that indicates once a person is infected with COVID-19 that they cannot get reinfected? And then what's your advice for people who have been infected and then are cured?
What was the last part? People who have been infected?
Can you just repeat that last part, Morgan? What happens with people who have been infected?
Yeah, after someone has been infected and then they're cured of the virus,
Can they get it?
Do they need to continue to be quarantined,
Yeah.
or what is the general advice for those people?
So let's start with the last part. So no, you don't need to continue to be quarantined. There is actually good guidance, and we rely on that for healthcare workers because we need healthcare workers to come back to work, and it's the 7 and 3 rule. So basically, you get symptoms on day 1. You don't want to see anybody for 7 days at a minimum, right? You want to quarantine yourself for 7 days. Then you want to add 3 days on to whenever the last day you had symptoms was. So perfect scenario, you get symptoms on day 1, they go away on day 4, day 5, day 6, day 7, you have no symptoms, you can go ahead and release yourself from quarantine. Some people might have symptoms all the way out to 8 or 9 or 10 days. And then if they stop, you've got to add 3 more symptom-free days onto that. So that's why the kind of duration of quarantine is a little bit confusing to some people. We don't know if people can get infected again. This is a big question. There are lots of people developing antibody tests. None of them right now are approved by the FDA for widespread use. So we can't really go out there and say, you've been infected, you probably have good antibodies against this, you're immune. We are looking at people who've been infected because we want to collect their antibodies, and you may have heard that that's a treatment that's being used for severely ill people, and we are probably going to start looking at that. We are looking at it already. I don't know when we're going to be able to implement it. So I would say the antibody testing is not really ready for prime time, and we just don't really know. As for the idea of getting infected intentionally, I'm sure you know that I'm trying to control myself and not freak out that people would do that. And the reason is, there are a couple of reasons. First of all, when you look at the CDC data that was came out last week, right, mortality in people younger than 40, so people in their 20s and 30s, wasn't really high, but they accounted for hospitalizations about 40% of the time, and they accounted for ICU beds about 10% of the time. So just because you're young doesn't mean you get a pass from a serious experience with this infection. And second, think about transmitting it to your parents, your grandparents, your neighbor who has had a transplant. It's really not responsible to want to get infected that way. Just save yourself for when the vaccine comes out, which we hope will be, probably about 16 months, 14 to 16 months, if we're lucky.
The line is unmuted. Does anybody else have a question for Dr. Marrazzo?
Tim Lockett from the Instant Star with just a clarification question. I just want to make sure I heard you right. Are you saying that if people want to wear masks, just average folks who don't work in healthcare, if they want to wear a mask when they go out, that's why not? Couldn't hurt, might help. Is that what you're saying?
I did say that, and I think that the CDC has been moving towards that position now for several days. There are, as a culture, I mean, if you've traveled at all in airports and certainly in Asia, you'll see it's not that uncommon for people to do that. People have done that for a long time. Here, of course, we've never seen that. I don't think I've ever seen routine mask wearing until now. So it is a big cultural shift, I think. That's probably one of the reasons why the CDC isn't saying you should do it. But they are being pretty permissive, and I would say most people who are thinking about this are being permissive. Again, what do you have to lose? When you look at what's happening in New York, Detroit, New Orleans, at this point, if it helps us avoid those scenarios, why not? Usually I'm more data-driven than that, but, we are in a crisis here, and anything we can do to prevent those scenarios reaching us, we really want to embrace.
And one caveat I just want to add, Tim and Dr. Marrazzo, correct me, that would be recommended for the public to wear a cloth or disposable, but if it's a mask like an N95 that a doctor would need, please give those resources to the people who need them.
Great point. We are right now prioritizing the various levels of personal protective equipment by what the healthcare worker is doing. So certainly for someone who's performing a procedure or taking care of a patient who's intubated, who's known to have COVID or under investigation, we want the highest level of protection for those people. So we do not want people essentially wasting high-level PPE by just walking around to the Piggly Wiggly with it.
Any other questions for Dr. Marrazzo? Okay. If that's all, then we're going to conclude. I'm going to remute everybody.
Thanks.